Hello friends, welcome to a new question. 51-year-old woman presents with dyspnea, rales in the upper lung fields and inspiratory wheezes. A chest radiograph shows reticulonodular pattern of infiltrates in the upper lobules with prominent hilar lymphadenopathy. A lung biopsy is performed and the results are shown here. Explain the pathological diagnosis of this lesion. The pathological diagnosis of this lesion is there is caseation, central pink caseation is seen in the center. And what is the infectious cause? It is Mycobacterium tuberculosis. Thank you for watching.